Merci. Hello and welcome to today's online virtual short course program with the title of Evidence-based Dentistry. Professor Hissari and I, Fariba Mutavassilian, are moderator of this program. Thank you all the audience taking time out being here with us for this short course program. I would like to appreciate Professor Khami, a faculty member of TUMS, Community Oral Health Department, for organizing this short course program. And this program is about 6 sessions, and I hope you enjoy it. As you know, evidence-based dentistry is an approach to patients' oral health care and requires the judicious integration of systematic assessment of clinically relevant scientific evidence relating to the patient's oral health medical condition with the dentist's clinical expertise and the patient's treatment needs. So the evidence-based dentistry bridges the gap between the research and clinical practice. I'm sure very useful and practical information will deliver to you in clear manner, and I fully expect that at the end of this program will influence your approach in dental practice, in research, in education, in any field you are. In this short course program, fabulous lecturer speak about different aspects of evidence-based dentistry. And now I would like to introduce today's speaker, lecturer. Our guest speaker is Professor Vitanen from University of Bergen, Norway, and Professor Khami and Professor Nekufar from TUMS. Professor Jörgen Vitanen has been a faculty member in the Department of Oral Public Health, University of Helsinki, Finland, and currently is working in the Department of Clinical Dentistry, Faculty of Medicine, University of Bergen, Norway. His expertise in the field of research and evidence-based dentistry will undoubtedly fortify our program. And now, about Professor Nekufar, I want to have a short, brief and summary of his resume, but he has a long resume and I have enough time to explain all the details. So you should just know he's an associate professor in the Dentic department and he's the director of international affairs of TUMS. He has a resume with many responsibilities, achievements, and publication of well-known journals, and all this cannot be presented in this short time. And Professor Khami received his PhD degree from Helsinki University in 2007 and is now working as a full professor in Community Oral Health Department in TUMS. He is also the head of Research Center for Caries Prevention in TUMS Research Institute and chief consultant of the TUMS Vice Chancellor for Global Strategies of International Affairs. We'll be running a live question and answer at the end of each session, about 15 minutes. If you have any question, you can write in the chat box as well. All your questions will be answered at the end of each session. Don't worry about it. Please, Professor Khami, stage is yours. Welcome, Professor Nekufar. Join to us. Most welcome, Professor Nekufar.
Okay.
Thank you. Thank you for presence.
Okay. In the name of God, the compassionate, the merciful. Okay, can you hear me? Do you have my voice?
Yes, Doctor, we have.
Okay, thank you. First of all, I would like to thank all the distinguished colleagues who kindly accepted to support our program, especially our international lecturers, Professor Virtanen from Norway, Professor Babu from UAE, and Professor Jacob from Malaysia, and also our professors in TUMS here, Professor Nekufar and Professor Shamshiri. We will start now the program. We now have a high number of participants, more than 300 colleagues and dentists and dental students from all over the world now have registered for this meeting. I know that maybe some of them just for some of the sessions, So I would like to thank all the participants and registrants. So when we have such a high number of participants, it is expected that they are not all at the same level regarding research and evidence-based dentistry. So for this course, we have a kind of a spiral design, meaning that first, for example, in this session, which is an introductory session, you will have an overall insight into the whole program, the topics that we will discuss more in the remaining sessions in the next days. And then in the next days, we will go deeper and deeper through the topics. And so we will expect those already familiar with the research and evidence-based dentistry to have a meaningful review and update regarding their skills and knowledge in this field. And also for the others, we expect that all the participants can acquire an acceptable level of knowledge and skills in this field. So now I start my presentation, which is Introduction to Evidence-based Dentistry, just to share some facts and figures, why we should be expert, why we should know, why we should be skillful as a dentist, as a clinical practitioner, why we should be expert in evidence-based dentistry and evidence-based approach. So let me, yes, I try to share my screen, and then so I've now shared my screen, but I think can you see my screen, my slides? If my colleagues tell me.
Yes, Dr. Khami.
Okay, you can see the slides.
Here you can be seen.
Okay. So, okay, yes, I'm Dr. Mohammad Reza Khami from Community Oral Health Department, and the outline of my presentation is these. You can see three main areas. What are three main reasons for being up to date in clinical practice? And then what are the main sources of information? And then just the definition of evidence-based dentistry as a starting point. So if you want to think about the main sources of information that we have, for example, in dental school when we are learning dentistry, and as an undergraduate students or postgraduate students, and then after graduation, it seems that there are three main resources for information. The first one is teachers and the educators in the dental schools. So the atmosphere of a dental school has been designed and planned just for learning and education, in addition to delivering healthcare services to the patients. But the main aim there in a dental school is education and learning. So our teachers and our professors and our educators are one of the main sources of information for us when we are learning dentistry, when we are in a dental school. We can ask them our questions when we have a problem, when we face a problem during treatment of a patient. They are ready to answer our questions. The second main resource for us is the textbooks. So we can have many, we can acquire knowledge through studying our textbooks. When we have problems, we can go to the reference books, textbooks, and study, try to find our answers. And then journal articles. Journal articles are our third main source of information when we want to do clinical practice. Regarding the textbooks, they are very good. They are very good. We know that they are very good. But there is a problem with the textbook. And the problem is that the information in a textbook may be outdated. This is because the process of developing and compiling a textbook takes a long time. There is a famous example of this. You know that HIV infection and HIV virus was first discovered in 1981 too. And when you go to the textbook of internal medicine, one of the famous textbooks in internal medicine, which is Harrison. And you go to the textbook, the edition published in 1984, meaning that at least 2 or 3 years after discovery of the virus and infection, you cannot find anything about HIV and AIDS in that textbook. So this clearly shows that there is a time, between when a textbook is compiled and published. So the information might not be updated. Okay, so and regarding our teachers, when we go to the topic of the level of evidence, then we will talk about expert opinion, expert committee opinion, and also the experience of our teachers and our clinical experience. And we will see how much value we can put on these sources of information when we want to use them as evidence for our everyday clinical practice. So why being up to date? This is a main question, and we should have a clear answer for that. Why do we need to be up to date when we are doing clinical practice? There are many reasons, surely, and you know that. But I just want to emphasize on 3 of them, which are maybe more important. The first one is a phenomenon called the slippery slope of clinical competence. So it says that expertise and effectiveness in some areas begin to deteriorate the moment that physicians leave medical school. When we are graduated from our schools, then we start to working. This phenomenon says that your clinical expertise will be decreasing and decreasing and decreasing through the time. So this is for physicians. It is surely true for dentists because we have many practical skills. Then the second main reason is consumer movement. We know that patients are starting to come to their dental appointments with information downloaded from the internet, some of which may be unfamiliar to the dentist. This is because of the new age of information and the new ICT information. All the information, many informations are now available for the patients. So we can compare the situation now with that, for example, 30 years ago. If a patient at that time wanted to have some information, for example, what is amalgam filling, what is amalgam, what is composite, what's the difference? So he or she should go to, for example, a library in a dental school, try to find some textbook, and then be able to read the textbook and understand the special terms and expressions. But now, just by some click in a mobile phone, it's possible to have many information. What is amalgam? What's the difference with composite? What are the characteristics of an amalgam filling? So many information. So this makes makes it necessary for us to be one step forward our patients, because if they, for example, ask a question and we don't know the answers, for example, about a new technique in bleaching, for example, in endodontics, for example, a new techniques, and if we don't know what is the answer, so it would be, I think, it is not good for a dentist. And the other point is that they are now aware of their rights. You know that the complaints, medical complaints of dentists and medical doctors now are increasing. There's a trend, increasing trend in all over, or in many, I think maybe all over the world, all of the countries. They have this trending of complaints from doctors and dentists because of patients. They are not the patients like, for example, 20 years ago, 10 years ago. They know they have rights. Even they want to participate and contribute to their treatment planning, and it is somehow their rights. We cannot say that, okay, no, I decide for your treatment plan. You cannot tell anything. This is my job. So the cooperative model of delivering oral health care services is now dominant instead of the paternalistic pattern that we had maybe 10 years ago or more. So this is the second reason that we should be up to date. We should have up-to-date information about our field and our clinical practice. And the third one, the last but not the least, the information explosion. We are now living in the era of communication and information skills. So, and now I want to tell something about this information explosion. So these, you can see some figures here. For example, daily 46 RCTs. And what is RCT? Certainly not root canal therapies here. It is randomized controlled trials that you know that it is one of the most expensive and most complicated types of studies. Many steps you should pass when you want to do a randomized controlled trial. So daily 46 RCTs are reported. 1,000 Medline new articles. And this one, Medline is just one of the databases that we have. It is a comprehensive database, of course, but we have other databases as well. So 1,000 Medline new articles per day seems huge. And if we go to biomedical articles and biomedical sciences, we come to the figure of 6,000. And this means annually 3 million articles. And if we think about the journals, 30,000 journals are published annually. The funny thing is that these statistics are for 10 years ago. And I purposely showed that here because you can see that during 10 years, of course, many of these figures now are much different than what you see here. So we have an estimation of doubling time of biomedical sciences. It has been about 19 years in 1991, but just 20 months in 2001. And it has been said that a general practitioner needs to read 19 articles every day for the whole year to be up to date. Oh, okay, it seems impossible. We have some other statistics about this doubling time of knowledge, biomedical knowledge, you can see here. So it has been 50 years in 1950, but 7 years in 1980, just 2.5 years in 2010. And it has been projected to be just 73 days by the year that we are in, 2020. Okay, so it just takes more than 2 months. That how much biomedical sciences that we have present after just about 73 days, we have it doubled. So I think these figures and these statistics clearly show that why do we mean when we are talking about information explosion. There are some other points. For example, students who began medical school in the autumn of 2010 will experience approximately 3 doubling in knowledge by the time they complete the minimum length of training, which is 7 years needed to practice medicine. So when we come to the students who will graduate in 2020, they will experience 4 doublings in knowledge. It is said that what was learned in the first 3 years of medical school will be just 6% of what is known at the end of the decade from 2010 to 2020. Okay, maybe you say that, okay, these are regarding medicine and medical practice, which we know that it's different from dentistry, but we can take a look. I have something about dentistry here, showing the number of articles published in and indexed in Medline. As I told, this Medline is one of the comprehensive databases. We have We do have a session on searching databases, and we will completely explain about the other databases. But this Medline is one of the biggest. So you can see the trend of indexing articles in this database from 2007 to 2017. The number you can see. And okay, about 10 million, more than 10 millions of articles have been indexed in this database. And if we come to the articles that have been indexed with dentistry as one of the medical subject headings terms, so with the medical subject heading terms of dentistry, we'll talk about this mesh in its session. Okay, it comes to about around. You can see here the number, around maybe 100,000, less than 100,000, and it stands about 1% of the whole articles published. Okay, it seems again huge. And the point is that this is just the articles that have been indexed by this dentistry mesh term. We know that in the field of dentistry, we have some other keywords, for example, oral health care, healthcare, dental health. So certainly the dental articles are not confined to just these around 100,000 articles. And also you can see the trend. So this was just an estimation of the amount of articles that are published in the field of dentistry. So I wanted just to show that what do we mean by information explosion. And then, okay, now but we have two important consideration here. Okay, we know that we have these high numbers of articles, but not all of this information is valid or useful for patient care. We know that many of these articles are, for example, in the field of basic sciences, which are really important, but it takes time that basic science study can have some clinical implications, are not related to our everyday clinical practice and for patient care. And the other point is that a little more than 1% of these articles are both rigorous and clinically relevant. So we have two problems here. First, the article should be relevant to patient care, and the other is that the article should be valid, a good study, a rigorous study. And as it has been said here, a little, just more than 1% is both rigorous and clinically relevant. So we can say that most research published in medical journals is too poorly done or insufficiently relevant to be clinically useful. Okay, so even you can see in prestigious journals, you can see some articles with certain deficiencies in, for example, the study method, in reporting, in conclusions. So just a small amount of these articles are useful for us. And the other very important point is conflicting findings. For example, we are searching to know, for example, for a periodontal disease, we are trying to know which of the two methods for periodontal surgery, for example, method A and method B, which of them are, for example, good, better, superior. Okay, then we search for articles and find 10 articles, and surprisingly, in, for example, 6 of them or 5 of them, method A is superior, has been shown to be superior, and in the 5 others, method B has been shown to be superior. What should we do? Which of these two methods are better, are superior? Okay, so this is very common. If you have searched for the answer for some of your clinical questions, you certainly have encountered this problem, the problem of conflicting findings. Okay, so Till now, we know that we have a huge amount of information published and reported every day. We have some clinical questions. We know that we should be up to date, but it is not possible to study all of the information that are published and reported every day. And we know that many of these articles are not relevant to our practice and are not good studies, are not valid studies. So what should we do? Okay, and at this point, we come to evidence-based dentistry. Evidence-based dentistry tries to solve this problem through an approach which have some steps. We will go through all the steps in our program, but just I want to this is the end of my presentation, just 2 or 3 slides, and just the definition of evidence-based dentistry. So the definition of evidence-based medicine, like many other topics, it has been started from medicine and then coming to dentistry. So the evidence-based medicine is the conscientious, explicit, and judicious use of best evidence in making decisions about care of individual patients. You can see here, evidence-based medicine is the integration of best research evidence with clinical expertise and patient values. I have bolded these 3 main items: best research evidence, clinical expertise, and patient values. It is important to know that evidence-based dentistry is just not about research evidence, but it tries to put research evidence along with clinical expertise of the practitioner and along with the patient preferences and values. This is very important, because if we just think about the research evidence and research studies, then maybe it does not work. So again, another definition of evidence-based dentistry, but with the same items, according to American Dental Association. So an approach to oral health care that requires the judicious integration of systematic assessment of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, together with 2 other things, which are dentist's clinical expertise and the patient's treatment needs and preferences. So this is the definition of evidence-based dentistry. And then it is said that the most valuable application of the evidence-based approach to the practice of dentistry is to encourage the dentist to look for and make sense of the evidence available in order to apply it to everyday clinical problems. So this everyday clinical problems is important when we face when we face a problem in our clinical practice. We should be able to define it clearly. This is the first step as teacher, Professor Jacob. Okay, can you hear me? Am I now connected?
Yes, now we can hear you.
Okay, just I finished just maybe one other slide. Okay, so I just share. Okay, so we should be able to define our problems clearly. This is the first steps. We should be able to search for the available evidence. We should be able to make sense of these evidences. We should be able to critically appraise the literature to find able to apply the evidences, and we should be able to evaluate the whole process. Okay, thank you everybody. If you have any question or comments, please just write down it in the chat, and then we will try to answer them as much as possible at the end of the 2 days programs. Now it's time for my dear colleagues and Professor Nekufar to continue today's program.
Okay, thank you very much, Mohammad, for your very informative talk. Should I wait for Dr. Motawassilian to put me through, or should I carry on?
Thank you, Professor Nekufar. The stage is yours. We are waiting for your grateful speak.
Okay, thank you very much indeed. And for the sake of the time, I'm going actually to start my talk right now. And what am I going to ask my colleagues around the world and all the participants, if it is okay for them to turn on the videos, then I'm able to feel I'm at my classroom and I'm talking with you and I can see you and see your reaction even. And I may ask some questions as well if you like, or you can give me some comments during my half-an-hour talk. So whoever of you is okay to turn on the videos, I prefer actually to see your beautiful faces and carry on. Okay, so I think, first of all, I deny any conflict of interest and I have not received any kind of payment for introducing any dental materials and equipment in this presentation. Because I may mention some names, I always prefer actually to have this sentence before I go further. So I think Mohammad has mentioned some very good reason, let's say, outcome of evidence-based. When we know evidence-based very well, we should be able to answer this question when we are in our clinical situation. So I'm in my clinical situation. I have received such a patient with these caries, with this broken premolars and molars, caries in mesial side of upper second molar and upper first molar in the distal side. And you can see the second premolar with a lot of problem. So you may help me and say, okay, what should I do? So if I want to answer to this question that, for example, what should I do for first premolar or second premolar? What should I do? The answer should be based on the guidelines. The answer should be based on the evidence that we available for us. So whatever available evidence is there, we should go there and find them and use the evidence to decide. So for decision making at the clinical level, we should be able to use evidence quickly. But we have, as Mohammad has mentioned, we have a pile of information, huge amount of information available, and we are not able to quickly digest them and use them for this patient. So let me show you another example. And this example is going to give us some sort of very important message for evidence-based dentistry. This is a patient that went to the clinic of a very famous endodontist around the world, Professor Mahmoud Rabinejad. And the patient suffered from an apical abscess in the upper three. And as you can see here, upper three has got a platal groove maybe, or even a dense invagination, something like that, and an open apex. So now it is time for decision making. What should I do? I need evidence for that. But Rabinejad at that time developed a material, and we know the material very well these days, and the name of the material is MTA. So he said, okay, that was before the official marketing of MTA, but Rabinejad filled a consent form, which is a part of the evidence working. So if you want to do and create some sort of evidence-based material, you need always to have consent from your patient, that I'm sure in the future sessions it will be discussed very well. By the way, Rabinejad filled the whole canal by his new material at that time, 1992. And at the follow-up, something magic happened. So you can see here the formation of the root apex, that these days we call it regeneration. So that is amazing. And after that, the material launched and a lot of evidence produced. So another case you can see here with open apex and broken crown. So the dentist decide to use same material, MTA, but for another approach, we called it apexogenesis. And he followed up the case, and very, very special reformation or regeneration of the apical part happened. So regeneration of the apical part or apexogenesis happened. Amazing. So now we have a material, MTA, that showed a lot of nice cases. Be very careful. A lot of nice cases, not a lot of high-level evidence. So, by the way, as a dentist, you can see another case as well by another very important developer of a new material, Said Askari, and he also showed a very nice dentin bridge formation on the top of the pulp tissue. Amazing. I showed you 3 cases with very, very nice result, very high level outcome. Amazing. So now it's time to decide to use this material. So a case like this came to my office. This is my case. So you can see open apex, you can see preapical disease. So what I decided to do, I decided actually to use this material or a material similar to that, or even according to the manufacturer, better than that. I fill the whole canal by biodentin. And you know, biodentin is the new generation of calcium silicate cement, which is somehow a very good MTA-like material, very promising material. And I followed what Trabinejad did. Trabinejad filled the whole root canal system with that, and I filled the whole root canal system with that, looking for a regeneration at the apical side. So in that situation, if I am looking for regeneration at the apical side, that means I need to be very careful about the evidence. But I was just decide to do that to become famous, very similar to those. And good things happened. I thought, oh yes, this is the follow-up of the case. Patients were very happy, and we know that Mamareza also said that it is important to think about the patient desire. So patient is very happy. I was very happy. And suddenly such a things happened. In my follow-up, you can see, wow, a nightmare, vertical fracture. Why did it happen? Why such a things happen? Because I overgeneralized the low-level evidence. The evidence that I used wasn't the evidence at the high level. That was just some case series or some case report. So if I want to do good things, I need to use my clinical expertise or other clinical expertise plus patient's reference preferences, but we should be very, very careful about the research evidence. We should use the research evidence, put the research evidence and my clinical expertise and other clinical expertise, or let's say the whole world clinical expertise all together, patient's preferences, and find out where they cover each other in the middle. And we called it EBD, or evidence-based dentistry. So if we want to use evidence-based dentistry to prevent from that nightmare that happened for me, we need to be very careful. Patient's preferences is very important, but shouldn't be overemphasized. Clinical expertise is very, very important, but it shouldn't be overemphasized. And research evidence are very important as well, but we should always find the way that they have the mutual part, they have a common part, and use that common part, which we call it evidence-based dentistry. Okay, in that situation, if we want to speak like that and say, okay, let's see what we have in terms of experience-based versus evidence-based, a lot of things will come. We need to be very careful about that. But we should know that it is impossible to answer every potential clinical question through randomized controlled trials, which is the high-level evidence. Definitely, I'm sure in the future sessions, we will discuss about the level evidence, clinical trials, randomized clinical trials, but I'm just giving you a taste of the importance of the evidence-based dentistry. Okay, let's go further. So therefore, we need rational thinking, we need even logical assumption, and we need reasoning. We use this for the decision making. So Mohammed said that when we have a case, we should say that, okay, what should I do? What should I do? Really, what should I do? We need to put together expertise, rational thinking, reasoning, assumptions, and research evidence with the highest level of the research evidence to decide what to do. But we need to be very careful. Comparing to the previous cycles that I showed you, if we put our experience somewhere and we overemphasize our experience, and we reduce the level of the pathophysiology references and also reduce the patient's values, we couldn't find any common area. Therefore, it becomes to very, very old way of medicine, which is based on the experience rather than the evidence. Okay, now let's move to this case. What should we do for the first premolar, second premolar, first molar, and the second molar? We need to put together our clinical expertise, patient's references, research evidence, and find the common area. Now I find the common area. But if we go to the traditional way, which is based on the experience mostly, it becomes like that. Oh my God, another nightmare. But this time, this nightmare is because the dentist decision-making was based on the experience only, or unfortunately sometimes on the marketing as well, and on the business side, which I'm not going to that. So this is the work that a dentist did for such a case. Comparing the left side and right side, you will find out based on the available evidence, available high-level evidence, it is definitely wrong to do such a decision. So what should we do to do that in a proper way? First, when we know what to do, that's it, we can do it. But when we don't know what to do, and when the question is, what should we do? We should make our clinical question very clear. Ask your clinical question, which can be based on the PICO. We will discuss that and I will show what does it mean. And then we need to go to the literature and search for our answer. I want to decide what to do when I have an open apex with necrotic pulp with preapical pathosis. I should search the literature for that. For the search of literature, it is very technical. We may end up with a lot of problem if we search wrongly, or if we search such huge databases, we may end up with a lot of information that we cannot digest those information. So then it comes to the appraise the retrieved documents. So you have a lot of documents, but you need to be very careful to put them together, to appraise them individually and decide which one is good, which one is not good, which one can be reject, which one can be include. So you need to think about that, to which one is good, and then you can apply your findings. Sometimes you may think that, okay, if I want to search, I prefer to search somewhere to give me the answer quickly and straightforward, rather than just give me the answer in a way that I need to appraise it myself and decide myself. Yes, it is available. There are a lot of databases that give you filtered information, that we call them secondary resources. Yes, primary resources for academic, primary resources for people that they want to find the best way of the appraisal of the evidence. They can search the primary resources. But for the people that they want actually to go to the answer quickly, there are a lot of good way to do that, and they can search the secondary sources that I will show you those. They give you the very, let's say, mini critical appraisal publication that you can use those mini critical appraisal or mini systematic reviews that give you the right answer for the decision making. So you can then apply those findings quickly in your clinical setting. But be very careful. The last part of the steps of the evidence-based dentistry is to evaluate. You need to assess your performance. When you decide to put, for example, biodentin like mine inside the canal, you need to assess and evaluate the performance and decide what to do. Okay, if I go to the details of the steps of EBD, I should say that ask. When you ask, turn your clinical problem into a question. The question should be focused. You should ask the focused question. And for this, you may use the PICO to create a very good search question. PICO stands for population, intervention, comparison, and outcome. And again, this is just a taste of that. And we have an extra session to give you some information. What does it mean? What does PICO means? And when we say population, what is the definition of population? When we say intervention, what is that? And comparison and outcome. When you do that, you can find the information, search the best evidence. The best evidence obviously is systematic reviews and randomized controlled trials, but you cannot always find the one. So you can use again your PICO question and choose the secondary or primary sources to find out the best result for the evidence that you need. And then it's time to appraise. When you want to appraise the evidence that you find, you can use the pre-appraised secondary sources that are available. If you go to Cochrane, for example, website, you can find many of the publications that give you all the information that you need, and we call them pre-appraised secondary sources. You rely on the appraisal of other people. But if you want to do that yourself, you need some tools for that. And this course that you register for that is to give you and to teach you how to appraise, how to critically think, how to put your expertise with patients' preferences and use the best evidence for the best decision making. And then now it's time to apply that. Translation of evidence into practice based on clinical expertise and patients' concerns. That is the most important thing. You don't need evidence just to write articles for that. You don't need evidence, okay, what's the point to search? What's the point to appraise? Just for the sake of publication? No, that is wrong. Don't do anything for the sake of publication. Do it for the sake of best clinical performance. Okay, we use that evidence for the best clinical performance, and now it's time to assess. So if I give you the steps of EBD and try to summarize that to 5 A's, it starts by ask, acquire, appraise, apply, and assess. When you assess, you should assess that how should I assess my performance? You need to know the way for that. That is another part of this course. We give you information. How do you evaluate your clinical performance? And then what does your patient think? That is also very important. And then at the end, how could you do it better next time? Then you become a good dentist. If you want to be a good dentist, you should follow these steps of evidence-based dentistry. Okay, let's go back to the nightmare that I showed you. We have an open apex. I fill the whole canal by a calcium silicate cement. Something like that happened because what I did extrapolation of evidence. Extrapolation of evidence means overgeneralization of the evidence. We have a simple or low-level evidence, and we overgeneralize that. As you can see in my slide, when a person makes comprehensive statement based on just a little evidence, we call it extrapolation, overgeneralization. We have a little evidence, we overgeneralize that and we use it. And this is the reason of a lot of problem in the clinical situation, overgeneralization. Scientifically, overgeneralization means extrapolation. Extrapolation means that you have evidence for A and you have evidence for B, and you know that the correlation of A and B, but you don't know anything about C, D, E, and F. You just overgeneralize the result and you just jump from A to D. This is wrong. You just jump from a case that Mahmoud Turabilaja did and fill the whole root canal by MTA to the one that Muhammad Nekufar did, and he did something wrong. Why? Because of overgeneralization. So be careful. If you want to follow the evidence-based step, you shouldn't come to a conclusion without sufficient evidence. You need sufficient evidence to follow all the steps. And if you want to have sufficient evidence, you should be very careful about the explosion of the information that Professor Khami showed you that. There is an explosion of guidelines. There is an explosion of evidence. There is an explosion of information. We need to be able to find the best one, to find out which one is good, which one is not good. That is coming to the appraise or critical appraisal. If you draw from a specific case for more general case, that is another definition for extrapolation, which is against the evidence-based dentistry. Let me give you some funny example. Some funny example is this. Some people looked at the swans and they said that, okay, every swan I have ever seen was white. Then they decide to say that therefore all swans must be white. But what happens if they see something black? A beautiful black swan. Then what is it? Is it a swan or not? Same thing happened for the clinical situation. In clinical situation, you see something, you overgeneralize that, you extrapolate that, then you see something else. In terms of diagnosis, it is very important. We need to be very careful about that. Or sometimes you may say that, okay, I know that some penguins are black and white. They have some black and they have some white part in their bodies. On the other hand, we know that some old TV shows are black and white as well. So the left side is about penguins. The left side of these sentences or these facts, both of them are true facts. Some penguins are black and white. The left side say that some penguins. The right side is black and white. The second sentence said that some old TV shows are black and white. So the right side of both facts and both sentences are similar. Mathematically, if some part of the equation is equal to another one, the left side also is equal. Therefore, some penguins are old TV shows. That is absolutely wrong. This is mathematics. This is not biology. That is another important thing in terms of evidence. When we look at the evidence, we shouldn't do logical errors. This is logic. When we say A is equal to B, then we say C is equal to B, therefore A is equal to C. This is right. This is mathematics. This is a statistic. But logically, this is an error when it comes to the biology. We need to be careful about such a things. These things happens when we look at the statistical significance versus biological relevance. It comes to the confound statistical significance with biological relevance. We need to be very careful. We need to mix up strengths of evidence against the null hypothesis to go to the result. I give you another example in 5 minutes that I still have. So some people believe that periodontal disease causes heart disease, Why they think like that? Because this was just some sort of association. But correlation does not imply causation. We need to be very careful. When something causes something else, that is different from correlation or association. We need to be very careful. Something may happen at the same time, but doesn't mean that this one is the reason of the other one. So this is what happened for many of the anecdotal thinking about the correlation of the heart disease and oral disease. There is no link between gum disease and heart disease. And this is a new scientific statement from the American Heart Association declares that there is insufficient evidence to prove gum disease causes atherosclerotic heart disease. So we need to be very careful about whatever happened. So then when I emphasize on the importance of EBD as a dentist and as a teacher in the School of Dentistry in Tehran University of Medical Sciences, we follow a lot of important things in terms of our curriculum. In our curriculum, according to CODA and a lot of accreditation body, we need to teach our students the way of critical thinking, and our graduate must be competent in use of critical thinking and problem solving, include their use in the comprehensive care of patient, scientific inquiry, and research methodology. This is very important. If our students are able and are competent enough for critical thinking, then they are able to identify the strengths and weakness of a research article, and they are able to assess the usefulness and validity of research findings, and they are able to evaluate the appropriateness of the study design for the research question, and they can assess the key methodological features of the study design, because when you want to appraise, you should know the study design and you should critically appraise the study design of the published article. And this is what we are going to teach you during this course. And you should be able to evaluate the suitability of the statistical method and its interpretation. Otherwise, you may think penguins are all TV shows. And then you need to be very careful about the conflict of interest. Conflict of interest is another topic of evidence-based dentistry, and we will discuss that very well in this course. And the important thing is the balance between your expertise, between your knowledge, your background knowledge of biology, background knowledge of anatomy, of all the logical things, and then put them together with the patient's preferences, end up with a very good service to give your patient, to be able to give the best service to your patient. You need to increase your background knowledge, obviously. You need to do animal studies. You need to do clinical trials, and you need to be able to use your patient preferences, put together everything, balance everything, ask the best question, apply the best question in your clinical situation. Be very, very careful about the pitfalls and drawbacks of the evidence-based dentistry, as well as other techniques. Then put all together, and good luck to give the best service to your patient. Thank you very much for your attention, and I'm very proud that I finished my talk exactly at 30 minutes. Goodbye.
Thank you, Professor Nekufar, for your absolutely great, amazing lecture. I really enjoy it. I really enjoy it and use it a lot. I want to hear your lecture several times and repeat it in mind to hack it in mind. It was very useful. I appreciate your lecture. I wish you the best, and thank you for participation in this program. Thank you. Have a nice time. Wish you a nice time for you. Thank you. I appreciate it. Great. Thank you. Okay, thank you, bye. And now is the time for break, about 15 minutes. Then after that, we would have the lecture professor from Norway. We are waiting for you. Now time is 3 p.m. So in a quarter later, we are waiting to you back here, starting the lecture of Professor Virtanen from Norway. So see you in next 15 minutes for a break, short break. Thank you. We'll see you again.